Yes, Assalamu alaikum. My name is Muhammad Awais and I'm one of the assistant professor in pediatric department of the State Medical College. Our today's topic is iron deficiency anemia. So, talking about the general considerations of iron deficiency anemia, as you are familiar with this term, it is actually microcytic hypochromic anemia, and it is one of the most common hematological disease of infancy and childhood. Iron is necessary for growth, and replacement of daily iron losses is supplied primarily by the diet you take. Iron is transported in plasma by a specialized transport protein called transferrin. And iron stores are concentrated in the liver, bone marrow, and spleen in the form of ferritin, from which iron can be mobilized readily. 0.8 to 1.5 milligram of iron must be absorbed each day from the diet, because only less than 10% of iron you take is absorbed from the diet. Not actually, you actually talking about kids. So in pediatric age group, only 10% iron is absorbed. So 8 to 15 milligram of iron daily is necessary in nutrition of the kids or infants or children. Iron is absorbed more efficiently from human milk than cow's milk. So the breast milk is the best. So the diets for formula fed infants should include iron fortified cereals or formula to prevent iron deficiency. Infants with iron deficiency anemia usually have history of consumption of large amount of cow's milk and late weaning and carbohydrates unsupplemented with iron. And blood loss also must be considered, like in cow's milk protein allergy. In addition to causing anemia, iron deficiency has severe effects on behavior and cognition, like apathy, irritability, and poor concentration in the school. What are the causes of iron deficiency anemia? We will categorize them. Like, first we'll discuss about nutritional causes. Like, if the mother is anemic, the baby born to that mother would be anemic. If there are repeated pregnancies, definitely the mother would be malnourished and anemic, the baby would be anemic. Increased iron demands, like in preterm babies, low birth weight babies, and babies having congenital cyanotic heart disease or any other chronic illness. Prolonged breastfeeding without weaning and cow's milk, especially. And our side, people used to give diluted or over diluted cow's milk. That is even more dangerous for causing iron deficiency anemia. Poor weaning or no weaning, like no vegetables and fruits in the weaning, or no meat in the, and where the child will get the iron from. The milk is not a rich source of iron, definitely. Impaired absorption of iron in malabsorption, like celiac disease or other diseases. Blood loss, especially in cow's milk protein allergy. In neonates, like feto-maternal transfusion, the baby born would be anemic. Twin-to-twin transfusion, one would be anemic. Obstetric complications such as placental abruption or placenta previa, or bleeding from umbilical cord of the newborn, or hemorrhagic disease of the newborn. And cow's milk protein allergy. In grown-up children, worm infestation like hookworm infestation, Meckel's diverticulum, peptic ulcer disease, rectal polyps, inflammatory bowel disease like Crohn's disease, ulcerative colitis. What could be the clinical findings in a child having anemia? So mild iron deficiency is relatively asymptomatic, except we can see the child would look a little bit pale. As it becomes more severe, the infant manifests irritability, anorexia, lethargy, easy fatigability. And milk-fed infant, you would see that they would be fat, pale, and sallow complexion, especially the babies, the infant on cow's milk. Other findings in severe kind of anemia would be tachycardia, or if you check the precordium, there would be systolic murmur in all the areas of precordium, flow murmur. If the anemia is very severe, like hemoglobin is less than 3 gram per deciliter, there may be signs of congestive heart failure. Like if you go for the examination precordium, there would be gallop rhythm, S1, S2, or S3 you may hear, and enlarged heart like cardiomegaly, the apex beat would be displaced from the normal position and neck veins would be distended. There can be hepatomegaly or enlarged liver span, or if you check the chest of the child, auscultate the chest, there would be bilateral rails or you can say fine crackles for congestive cardiac failure. And also another sign on in the nails is Koilonychia in long-standing iron deficiency anemia, like spoon-shaped nails. How you diagnose anemia clinically and to some extent, but we do CBC, complete blood count, which shows hemoglobin is low in these kids, and the reticulocyte count is normal or minimally elevated. Leukocyte counts are normal. RBC morphology shows microcytic, hypochromic anemia, and like small microcytic means small RBCs, and hypochromic is more central pallor than normal in the RBCs. And isocytosis, like different sizes of RBCs, and poikilocytosis is altered shape of RBCs may be seen. Mean corpuscular volume, mean corpuscular hemoglobin, and mean corpuscular hemoglobin concentration, they're all reduced in iron deficiency anemia. Serum iron level, serum ferritin level are reduced, and iron binding capacity, the transferrin level, is increased, and the percentage of saturation is low, usually less than 20%. Bone marrow examination is usually not indicated, but when performed, it shows micro-normoblastic hyperplasia of erythroid elements and decreased or absent stainable iron. Here you can see a peripheral smear showing microcytic hypochromic anemia, like small size of RBCs and increased central pallor. What are the differential diagnoses of microcytic hypochromic anemia? First, we have discussed iron deficiency anemia, then beta thalassemia, then lead poisoning, and then anemia of chronic inflammation or infection. How we could prevent iron deficiency in our society? Breastfeeding should be encouraged at all levels. Addition of supplemental iron is recommended at 4 to 6 months of age in breastfeeding babies. That could be in the form of fortified cereals at the time of weaning. It could be in the form of medication. Sometimes infants who are not breastfed should receive iron fortified formula for the first year at least. Encourage the ingestion of food richer in iron, like meat, like chicken, like vegetables and fruits. They enhance the absorption of iron as well. Management, the goals of therapy are to return the hemoglobin to physiological levels. Iron therapy. So mild to moderate anemia without the signs of cardiac decompensation can be managed by administration of iron. So oral iron is given at the dosage of 3 to 6 mg per kg per day of elemental iron. The treatment is continued for a period of 2 to 3 months even after the hemoglobin level has returned to normal. This allows replenishment of tissue iron stores. Dietary counseling is very important in our country, like infants should be given iron fortified milk formula, and before this definitely breastfeeding. At weaning, vegetables, fruits, cereals, eggs and meat should be given. In severe anemia, blood transfusion. In severe anemia with signs of cardiac decompensation, packed red blood cells are transfused very slowly and can be repeated in 12 to 24 hours if necessary. Correct any cause of chronic blood loss. Correct underlying disorders, for example, malabsorption, etc. Thank you very much. If you have any question, you could ask in the comment section in the YouTube channel. Thanks.